Ozempic side effects, we're gonna talk about the good, the bad, and the ugly. If you haven't seen my other videos about Ozempic, which is also known as semaglutide, there are links in the description to those videos where I cover what it is, how it works, and all of its benefits. But today I want to focus just on the side effects because that seems to be everyone's biggest concern. So let's get into it. First off, I am not a medical professional. This video is for educational purposes only. And as always, make sure to speak with your doctor if you have any medical concerns or before making any changes to your diet or lifestyle. Now, the first category of side effects that we are going to look at are what I like to call the good side effects, the ones that people actually want and are looking for. So here we go. Weight loss, which can also include fat redistribution. People describe this as losing weight in the midsection and gaining weight in the breasts. Some people even say they've gained weight overall, but it's all in the butt, and yes, you heard me right. There was one study done in 2021 where researchers found that participants on Ozempic increased their muscle mass while also decreasing their body fat percentage. So that's pretty cool. Next, decreased appetite. With all the studies being done on Ozempic, this has been the most common side effect that people experience, and since it decreases appetite, it helps people stop eating as much, which can lead to weight loss. Then we have improved cholesterol levels. There were two studies done, one in 2021 and the other in 2022, where researchers looked at participants taking Ozempic for 18 weeks. And in both of these studies, there was a decrease in total cholesterol as well as LDL, which is the bad cholesterol, and an increase in HDL, which is the good cholesterol. Then we have improvements in blood sugar control, which means it will help with insulin resistance. There was a case report in 2021 where researchers reported on a 45-year-old woman with type 2 diabetes. And after 3 months on Ozempic, not only did her blood sugar improve, but she was even able to discontinue her oral diabetes medication. And then lastly, improved mental health. This isn't directly related to Ozempic, but since it does cause weight loss, it's still worth mentioning. Improved mental health is often a side effect of weight loss because when people lose weight, they gain confidence, they gain independence, they tend to feel better about themselves, and they are more likely to participate in activities that boost their mood. Now for the second category, we have the bad side effects. These are side effects that people aren't thrilled about, but they usually go away after a few days of being on the medication. The most common side effect that falls into this category is nausea, and it happens within the first couple weeks of starting Ozempic. Usually it goes away on its own, but you can also take things like Tums or Rolaids to help alleviate it. You can also decrease your dose, or you could just take your dose once a week instead of multiple times a week. Next up is vomiting, which I didn't see too many people mention, but I did see a couple case reports about it. I would say this is probably similar to the nausea, and it should go away after a few days. Then we have diarrhea. This is another common side effect that typically goes away on its own, but it can also be alleviated by taking something like Imodium. Next up is constipation, which again is another common side effect that should go away on its own. But if it doesn't, you can take something like Kolache or another stool softener. The next side effect is abdominal pain, which again is something that I saw mentioned several times, but typically it wasn't a huge deal and it went away on its own. Next is dizziness, and this is another side effect that I'm not sure I can link directly to Ozempic, but I did see it mentioned several times. It's possible that some people felt dizzy after receiving an injection, but I also think it could have been a side effect of the low blood sugar because Ozempic causes an increase in insulin, which can result in low blood sugar, which can cause you to feel dizzy. Next is headache. Again, this is another side effect that I don't know if I can link directly to Ozempic, but it was mentioned several times. Next up is fatigue. Now this was definitely linked to Ozempic, but it wasn't necessarily a bad thing because with Ozempic you lose weight, you have improved cholesterol levels, you have improved blood sugar control, and all of these things are beneficial and they're going to make you feel better overall. So the fatigue that people experienced on Ozempic was more so from the fact that they were exercising more than usual because they had more energy and they felt better overall. Next is taste disorders. Now this includes things like altered taste, bitter taste, or metallic taste in the mouth, and this side effect was usually temporary. But it was also dose dependent, meaning that the higher the dose someone took, the more likely they were to experience this side effect. Next is pancreatitis. Now this is inflammation of the pancreas, and it is important to note that this side effect was observed in the animal studies, but it was not observed in humans. However, there was one case report in 2021 where a 63-year-old man presented to the emergency room with severe abdominal pain. He had recently started taking Ozempic and he had a history of chronic alcohol use, and then lastly, thyroid tumors. Now this side effect was observed in mice, but it was not observed in human clinical trials. It is important to note that rats on a high dose of semaglutide developed thyroid tumors after 78 weeks, and the doses they were exposed to were much higher than the doses that humans are exposed to. Which brings us to the third category of side effects, the ugly side effects, the ones that people don't want to talk about. And the first one that comes to mind is thyroid cancer. Now I want to preface this by saying that the risk of developing thyroid cancer from taking Ozempic is extremely low. But in 2022, the FDA released a safety announcement that revealed an increased risk of thyroid cancer in people who took a class of drugs called GLP-1 receptor agonists. This class of drugs includes Ozempic as well as Byetta, Bydureon, Trulicity, and a few others. According to the FDA, there were 18 cases of thyroid cancer in patients who took these medications compared to the expected number of cases, which was 3.7. What is important to know is that they did not find a causal relationship between taking these medications and developing thyroid cancer. They simply found an association, and since the benefit of taking these medications for certain conditions outweighs the risks, they still recommend that people take them. But I do think it's important to mention. And then there's kidney cancer. Now, similar to thyroid cancer, there's an increased risk of kidney cancer, but the benefit of taking Ozempic still outweighs the risks. And then we have the risk of suicide. Now, this is extremely rare, and it is important to note that this risk was observed in people who took semaglutide as part of a weight loss program, and it was associated with a specific brand of semaglutide which is called Wegovy. Semaglutide is the generic form of Ozempic, and it's also the active ingredient in Wegovy. But Wegovy is a higher dose of semaglutide. There were no cases of suicide that were reported in any of the studies done on Ozempic. But if you are on Ozempic and you start having thoughts of suicide, please reach out for help. There are resources available to help you. And then lastly, I need to talk about the elephant in the room, which is the risk of Ozempic causing pancreatic cancer. There was a study published in 2023 that claimed that Ozempic increases the risk of pancreatic cancer, but it turns out that the data used in this study came from a different study where researchers analyzed 19 million people who were taking Ozempic as well as another medication called allogliptin, and they found an increased risk of pancreatic cancer. However, allogliptin has been associated with an increased risk of pancreatic cancer in the past. So it's possible that this risk is actually due to allogliptin and not Ozempic. And as far as Ozempic goes, there have been numerous studies done showing that it does not increase the risk of pancreatic cancer. With all of that said, you should still get screened if you're at risk. There is a link in the description to a video where I discuss how to reduce your risk of pancreatic cancer. If you enjoyed this video, please share it with anyone you think it might help, and don't forget to subscribe. As always, I appreciate you stopping by, and I'll see you next time.